My name is Dr. Laura Perkel, and I would like to explain to you the difference between some of the disc injuries that we see at our chiropractic office. A herniation is often thought of as an actual prolapse or a propulsion of the gel-like nuclear substance in the disc itself. Often this occurs as a result of an impact or compression type trauma, but it can also occur for other reasons. A weak disc annular ligament or an extensive amount of force put into an injury or trauma can cause a disc herniation. A herniation is different than a bulge because the actual nuclear material comes out of the encasement called the annular ligament. At this point, it can be free floating in the spinal canal and can impact different levels and different pieces of the spinal cord that it's adjacent to. In this particular instance, we need to make sure that the herniation is small and not compressing any of the nerves through the spinal column. As far as a disc bulge, which many of my patients are diagnosed with by age 30 and on, from no trauma, that's found incidentally maybe on a CT or an MRI for another problem, we will find these disc bulges. A bulge is simply where the disc has changed position and has moved posterior. The reason why a bulge is concerning is because it can bulge quite significantly as well. And even though there's no extruded disc gel or disc material, you will get enough of a bulge at times that it can press into the spinal cord, especially in middle age. Typically past the age of 40, 45, 50, we do not see acute disc herniations, but we can see older patients with osteoarthritis and disc thinning that allow that bulge to grow. So we'll see an exacerbation of a lower back herniation that way. Oftentimes either one of these, a bulge or a herniation, can cause significant leg pain. If you have had a lumbar injury and want to assess for a disc injury, especially if you're having leg pain, visit a local chiropractor or visit chironerd.com to learn more about it.